will start shortly.
Live digital and doctor-generated medical content platform. So, short glimpse of ClirNet. Thank you so much all for your patience. Now, I would like to hand over the session to Ms. Aatika ma'am for next proceedings. Ma'am, over to you.
Thank you. We can start now.
Okay, good evening, everyone. So I would like to start this session with a small message in the form of a quote. A pint of blood can save 3 precious lives, and nothing can match the satisfaction a donor derives. Now, with this message, I would like to extend our warm wishes to all of you.
Good evening, everyone. Thank you for joining us for today's webinar. We welcome you all on the behalf of Indian Medical Association, Medical Students Network, Jnmc Aligarh, in collaboration with ClirNet. I, Saima Zehra.
And I, Raghav Juneja.
We are the council members of IMA MSN and host for this session. So today's conversation is gonna be engaging, innovative, informative, and luckily inspiring as well. So welcome on board.
Now, before proceeding further and inviting our panelists, here are some instructions for today's session. This session may bring up a lot of questions in your mind. Just write them down in the chat box and we'll try to address as many as we can. And at the last of this session, you will be given a link to the feedback form, which you must fill to ensure that you are awarded with the participation certificate.
So before proceeding further, here's a short inspirational story of a real-life superhero, James Harrison, a man with golden arms. On the surface, James appeared to be just an average guy, but one shouldn't judge a book by its cover. It's under the surface what makes him unique. When he was 13 years old, James underwent a major chest surgery and had a blood transfusion. This was his eureka moment when he realized it was the donated blood which saved his life. He started donating blood when he turned 18. Surprisingly, later it was found that he has a very rare blood group enriched with antibodies against TRH group antigens. This anti-D antibodies is given to mothers who are potentially at a risk of developing hemolytic disease in their newborns. James has been donating blood every week for over 60 years now, saving the lives of around 2.4 million unborn babies. Now, at the age of 81 years, which is the maximum legal age for blood donation in Australia, he is finally retiring. So that's how he is entitled as the man with golden arms.
Wow, that was quite an inspirational story. And it's good to be inspired by such virtuous beings on earth. And at the end of this session, I'm sure that many of you would be inspired by our legendary panelists present here. So I would like to welcome Saima to please welcome our panelists.
So our first panelist is Dr. Major Fawad Khan. He is currently serving as a senior medical officer at Jnmc AMU Blood Bank. He has been serving this profession for the last 27 long years after completing his MBBS and MD pathology from Jnmc. Sir has also served our country as a medical officer at the Indian Army Medical Corps. He has also worked as an administration head and clinical pathologist at Oroprobe Labs and was a laboratory program manager at Clinton Foundation. He has also received training at the Tata Cancer Research Memorial Institute. It's a great pleasure to have you here with us, sir.
Now, I would like to introduce you to our second speaker of the evening, Professor Prantar Chakrabarti. Sir is a renowned personality in the field of clinical hematology. He has done his DNB medicine and DM from the Premier Institute of AIMS New Delhi and has an enriching experience of more than 17 years in which he has worked as a professor, head of hematology in the NRS Medical College, and a senior consultant hematologist at various famous hospitals like Novel Medical Solutions, VIMS Kolkata, Fortis Hospital Anandpura, and currently Sir is working as the head of hematology at BMT and bone marrow transplant at AMRI Hospital, Mukundapur. Sir has more than 50 publications under his name and has provided his expert insight in various textbooks of hematology. Sir, it's an honor to have you among us today.
So now inviting our first panelist, Dr. Fawad Answer. Sir, I request you to continue further. Thank you.
Thank you, Zehra, and thank you IMA MSN for inviting me on this platform and allowing me to give a talk on blood donation. Thank you very much. Today, I'm going to talk to you about blood donation, and let's talk about. I'll cover this the topic under the headings of Blood Donor Day, then the significance of blood donation. Then we'll talk about blood products, blood donors, and regulations in our country. What is the criteria for donation, adverse events, precautions, and the challenges we face. So now starting with the Blood Donor Day. The World Blood Donor Day was started on 14 June in the year of 2004 by WHO. And why was it started? It was started because it was felt that we need to increase the public awareness about blood donation, and also we need to thank the voluntary blood donors. So in order to do that, WHO started this campaign, this Blood Donor Day, celebration of Blood Donor Day. And the goal of this initiative is to provide universal access to safe blood to everyone. And this year's Blood Donor Day slogan is "Give blood and keep the world beating." Next slide, please. So now the question is, why do we need blood donation? Why there is a constant need of blood donation? Why do we need to organize camps, blood donations? You are must be always be hearing that there is a blood donation camp there and people are going to donate blood. The reason is simple, that blood is very precious because it cannot be manufactured till now. Though the medical sciences has made immense advances, but still at a practical level, at a mass level, blood can still not be artificially prepared. We still need to have blood donated by someone. So human beings are the only source. And the other reason for regular blood donation is that we can keep the blood in the blood bank only for a limited period of time. After that, it expires. So that's why there's a need for regular replenishment of blood. And we know that blood is required for, it's a life-saving commodity. And it is required for emergencies, planned operations, in chemotherapy. Next slide, please. No, go back, please. Chemotherapy, and yeah, please go forward. Yeah, so and basically it is regularly needed by especially by children who are suffering from hemophilia, thalassemia, sickle cell anemia. Also, people who are undergoing chemotherapy for malignancy, because they need regular blood transfusions. If they don't get it, they are not going to survive. And then people of anemia, they also need blood. So that's why it is very important to conduct regular blood donation and keep our blood bank full with blood. Apart from that, we know that everybody says the blood is red, so it's all same. Though, but it is not, because we all know that it is blood has got many blood groups. So it is important and it is required actually that we give the same blood groups, a matched blood to the patient. So there is always need of blood bank keeping all the blood groups in the blood bank. So that's why it is important for the blood donation to be done regularly, so that the blood bank always has blood, all kind of blood groups. Next slide, please. Now, let's talk about blood and its blood products. Now, with the medical advances, now blood, which is as it is given donated by the donor, it is called whole blood. Now we can, as we all know, that blood has got many components. Like the fluid component, it's called plasma. Solid components are cells, and then there are proteins in the blood. So accordingly, they can be separated into packed RBCs, into platelets, plasma, and then the coagulation factors into cryoprecipitate. So that's why it is said that if one donates blood, he is going to save at least 3 lives by making PRBC, platelets, and plasma out of that, or cryoprecipitate plasma, or cryo, one of it. So that's why we say that we can save 3 lives, and this is a very, very important message to be conveyed to everyone in the public awareness campaign, that one can act as next to God by saving lives by donating blood. And then through apheresis, this is another process of the collection of blood products. We can also collect blood stem cells, granulocytes, and platelets. Next slide, please. Now let's talk about the key fact. Now, we should know that scenario of blood donation, blood collection, not only in our own country but also in the world. So beginning with the world, as per WHO 2020 June statistics, 118.5 million donations were made globally, and out of that 40% were made in high income countries, which was home to only 16% of world population. So you can see there is gross disparity in the availability of the blood vis-a-vis the population. Because as you see that only 16% of world population has access to 40% of the blood, whereas 84% of the world blood population has access to only 60% of the blood. So there is broad disparity in the access. And then you can also see that almost half of the blood donated in low-income countries is consumed by children under 5 years of age, whereas in high-income countries, you can see most of the blood goes to old people. Now, coming to the blood donation rate, you can see in high-income countries, about 31.5 people donate out of 1,000 people. Whereas in low-income countries, it is only 5 out of 1,000 people. So you can see the potential for us to make people aware and get more blood. So, and in India, it is still less than 1%. Please go ahead. And out of 79 countries, which are out of total countries which are reporting to WHO, 79 countries, 90% of blood supply is given by voluntary unpaid blood donors, which is considered to be the safest one. Whereas in 56 countries, 50% of the blood supply comes from either from replacement or paid donors, and these both the categories, they are less safe than the voluntary paid donors. In fact, the paid donors are the unsafe and they are not legally allowed. Please go back. Yeah. So now, whenever blood is collected, it's mandatory need to get screened for certain infections which are transmitted through blood to make the blood safe, and which are HIV, hepatitis B and C, syphilis, and in India we also do malaria. But you can see the 12 countries still do not do all the tests. So the blood is not blood all around the globe is not equally safe. So, and another thing is national blood policy, which is mandated by the WHO. Only 72% of the reporting countries, they follow it. And hemovigilance system is basically to improve the blood management basically, and to avoid transfusion reactions and other problems in the from blood collection to follow up of the transfusion in the patients. It's only being followed in 49% of the countries, and only 50% of the countries, they have transfusion committee in hospitals. Next, please. Now, coming to India, as per the 2016 statistics from Ministry of Health and Family Welfare, 10.9 million units were donated, as opposed to requirement of 12 million. And in 2019, it was 12.7 million units were donated. As per a study from Lancet, which, mind you, which does not talk about the actual numbers, but it talks about the mathematical calculation and the mathematical estimation. It says that about there is a shortage of 41 million. It talks about basically need and availability. So it talks about there is a shortage of 41 million units of blood, which is like the demand is 400 times more than the supply. But mind you, this is not fact, but this is the mathematical estimation. So in India, there are 63 districts in India still do not have blood bank. Next, please. Next slide, please. Yeah. So in India, all over, go back. Yes. No, next one. Yeah. So in India, all over the world, the testing, screening of the transfusion transmitted infection is can be done by rapid methods, and there's another technology, ELISA and NAT. NAT is the best one, but both ELISA and NAT are ideally required for the screening of the blood. So in India, still not all the blood banks are doing ELISA. There are certain places where still rapid test is being used, which is less sensitive and specific. And most of the blood banks in India, they are doing ELISA. NAT being the costliest, it is still being done in very few places in India. And voluntary blood donation, as per one statistics, is 84%. But mind you, this includes the replacement donor, which strictly speaking is not actually voluntary blood donation. And repeat donors in India are 0 to 30%, which should increase because the repeat voluntary blood donors are the safest one. Next slide, please. Now about the regulatory, the official framework about blood donation, blood services in India is basically composed of Drug and Cosmetic Act 1940, in which the blood is considered as a drug. And then there's a national blood policy, which was implemented in 2002. Then there's a drug control authority headed by Drug Controller General, whose job is basically for inspection and implementation of the guidelines. And then there's National AIDS Control Organization, National Blood Transfusion Councils, and State Blood Transfusion Councils, whose main job is to draft guidelines or give technical support. Next slide, please. Now, coming to the blood donors. Blood donors are divided into three categories: voluntary blood donors, then there are directed blood donors or replacement blood donors, and third one is professional blood donors. Now, voluntary blood donors, they are considered to be the safest because they come out of their own volition. They come out of their own motivation. And if they donate regularly, they are considered to be the safest. And our goal is also to have all the blood donation finally to be done only by voluntary blood donors. The replacement blood donors, as you say, you can understand, they are basically the one who give blood in replacement from the blood bank. So usually they are relatives. So since they have a motive behind giving blood because they want to help their relatives, their patients, so chances are that they might hide some important critical information. So they are less safe than the voluntary blood donors. And last category is professional donors, who are legally not allowed. They have, because they might be having all kinds of infection, especially HIV, hepatitis B, C, and also their blood is of poor quality. But this is professional donors are menace to our society, especially in India, because of the unavailability of voluntary blood donation. So blood bank has to face a lot of problems dealing with professional blood donors. And we need to, to deal with this problem in a very comprehensive manner. Presently, there is still no particular law which prohibits professional blood donation. There are general acts are there, but there is no particular law which prohibits professional blood donation. Next slide, please. So, talking about voluntary blood donation, so voluntary, non-remunerated, regular blood donor is the one which we want. Since he is doing voluntary, he's not taking any money, so he has no other ulterior motive. And since he is a regular donor, he's being screened very regularly, so we can counter the window periods of the diseases which go through blood. So he is considered to be the safest, and he is the one which we prefer and we should have for all the blood donations. Next slide, please. Now, let's talk about the criteria for blood donations. So here are some of the criteria. So like age is from 18 to 65 years. Weight should be, depending upon the amount of blood given, it could range from 45 to 55 kg. Then hemoglobin should be minimum of 12.5 gram%. And if the donor is a lady, then she should not be pregnant, she should not be lactating, she should not be menstruating. And if there is a repeat donation, there has to be a minimum gap of 3 months. And apart from that, as is currently relevant, that if the person has been in contact with some disease like or has gone to endemic area, then we have to take that particular history, and we have to ensure that he is not having that particular disease at the moment. Then there are also history of vaccination and medication. These all things also need to be taken into consideration. So important thing is that whosoever gives blood, he should feel healthy, and then he should not hide anything when he's giving history to the doctor or the counselor, because it is very important not only for his own health, but also because his blood is going to go to some patient, and if he hides something, it might lead to some harm to him or the patient. Next slide, please. Next slide, please. Next slide. Yeah. So now, what is the procedure for blood donation? So the entire process of blood donation should not take more than 20-25 minutes, and it starts with the donor entering the blood donation camp or the blood bank, where he's registered. Then history and examination is done by a doctor, and where relevant questions are asked to ensure that he's healthy and he's not carrying any infection, and it is safe for him to donate blood, and it is safe for the patient to receive his blood. Then he's bled, and after that he's given refreshment and allowed to recover. About 10 minutes he's given. He needs to stay in the blood bank, and then thereafter the blood goes for testing and processing. So amount of blood which is taken usually is 350 ml or 450 ml. The time taken at the most, it takes about 8 to 10 minutes. I would say that the amount of blood which is there generally in everybody, in human beings, though it depends upon the actual weight, but it is usually between around 5 liters. And if somebody gives 350 to 450 ml, so it is like giving 1 unit out of 10, 11 units. So you can see that it is absolutely safe, because you are giving very little amount of the whole blood which you have inside your body. And so this is very important. Whenever you want to convince somebody, you need to tell him that it is only like the person has got 10 batteries, he is going to give only 1 battery. 9 batteries would still be charging him, so he will not run short of any energy. Next slide, please. Then there are certain things which you need to remember when you are going to donate blood. That you need to have full sleep previous night, and you should not have taken any alcohol in the previous night, that is in 12 hours. You should not be fasting. You should have had a light meal at least 4 hours before the donation. And the most important thing is hydration. His hydration should be good. He should have everybody who going to donate blood should take at least a glass of water before he goes to donate blood, because 95% of the adverse effect which may happen to any blood donor can be avoided if his hydration is good. So this is very important thing, that whenever anybody goes for donation, he must have good hydration. He must take at least a glass of water before he goes to donate, and he must have had a light meal at least 4 hours before the blood donation. If he does this, we can avoid a lot of adverse events. We can avoid a lot of uncomfortable things. His experience will be good. And this is very important for blood bank to make a donor's experience good in the blood bank, because then only he will convey this thing to other people, and then will also return. That's what we want. And any donor should not do any strenuous activity before as well as at least 12 hours after blood donation. And he should not be riding any four-wheeler or two-wheeler simply because there might sometimes there is dizziness, and which can lead to accidents. And for the same reason, he should not interact with heavy machines. He should avoid heights. And if there's any discomfort anytime, he must contact the blood bank immediately. Next slide, please. And apart from that, certain adverse reactions, or you can say adverse events, are there. Next slide, please. Yeah. So there are certain adverse reactions or adverse events which may happen. Usually blood donation is absolutely safe. Nothing happens. There is no event usually take place if we take proper precaution, as I told you. But still, sometime there could be some adverse events. Usually they are not significant. Usually they do not require any treatment, and usually they are in the form of local reaction. That is, there's some swelling is there. There may be some bruise. There may be some pain, some bleeding, and that can be locally attended to. And most of the time they do not require any treatment, or at the most cold fermentation on for the next 12 hours. But sometimes and also he can feel during the donation and after blood donation, he can also feel weakness and pallor, sweating, dizziness, nausea, usually due to anxiety. So anxiety is very important thing which a donor as well as the blood bank staff should take care of, because person is anxious, he may get these kind of symptoms, which can totally be avoided if we make the person comfortable. So making person comfortable in the blood bank, the donor, is very, very important. Then, because since person is losing blood volume, sometimes there is a vasovagal response which could lead, which should be attended to immediately. And vasovagal response could be in the form of like pallor, like sweating, dizziness, and sometimes when it becomes severe, it can lead to syncope and loss of consciousness. So whenever a person feels the complaints of weakness or dizziness or feeling nauseous, what we should do is, if he's sitting, he should keep his head between the legs, or if he's lying down, we should take him to the Trendelenburg position, which is keeping his lower limbs at a higher position and head at a lower position, so that most of the blood goes to the heart, and that the body which is feeling a loss of blood volume doesn't feel so. So, and in some certain cases, very rarely which happen, is like sometimes the patient donor can have muscle spasm, loss of instinctive control, seizures. So whenever these kind of things happen, you should immediately take the donor to the emergency. Also in the blood bank itself, we have the first aid kits. As the first responders, we have all the things which required to resuscitate the donor or to support him, to treat him. So next slide, please. One more thing which is still there is the challenges. So what are the challenges we face? So challenges are in the term, the biggest challenge for blood donation, which is felt by the system, is the ignorance about the blood donation. Most of the public is totally unaware about the blood donation, its significance. Also, public is very much anxious and worried about blood, because they all consider that blood is such important thing. If they give blood, they will feel weakness. They might get some kind of disease. They might die. And I have seen people, even parents, not agreeing to donate blood to to their children. Husband and wife not ready to donate blood to each other. Why? Because they are not aware. So public awareness is the most important thing, the most important challenge we have got. And this can be addressed by public campaigns, by making people aware of the blood donation and its key points. And apart from that, other challenge is the infrastructure. We know that the establishing a blood bank is a very costly affair. There's a need of lot of equipment, as well as we need trained staff, and there's a need of mandatory licensing. So it's a costly affair. It's a time consuming affair. So apart from that, the another challenge is that the blood product, though we are by law, we can't, the blood banking system can't take any profit out of blood donation or out of dispensing blood products, but the cost itself it becomes quite high. And even in the public setup, blood bank product starts costs from 400 rupees in UP to up to 1200 rupees. So and not to talk about the private corporate hospitals. So it is still a costly affair for the general public. Apart from that, other challenges that, as we know, that since the blood bank is blood gets expired after a certain period of time, so there is regular need of regular replenishment. Another thing which is very, very important in our country is the problem of blood wastage. 6.3% of the blood collected is wasted in our country, against the standard of 1% blood wasted in the rest of the world. And this blood wastage is not because the blood was found positive for some disease. This is because of some other reasons, like blood was asked to be prepared, but then it was not used, or blood didn't reach the transfusion for the patient in the right time, within the time, or a doctor forgot to transfuse blood. Also, or there was a defect in the blood bag, or so these kind of things. These lead to 6.3% wastage of blood, which is very, very bad. So these are some challenges which we face. So with this, I stop here. Any questions, please, you may ask now. Thank you.
Thank you so much, Fawad sir, for giving your valuable insight on the importance of blood donation. It was a wonderful session with you. Thank you for joining us. Professor Syed Ziaur Rahman sir from Department of Pharmacology, AMU, has also joined us. He is the patron of IMA MSN Jnmc unit and also a founder trustee of Ibn Sina Academy of Medieval Sciences and Medicine. Sir has been actively guiding us throughout. It's a pleasure to have you here with us, sir.
Okay,
thank you so much. Okay, go ahead, please. Okay, thank you so much. Okay, go ahead. Please invite second speaker. Thank you.
Yes, sir. Thank you, sir. So now I would like to invite our second speaker, Professor Prantar Chakrabarti, sir. And before moving to the questions, I would like to tell the severity of the condition nowadays. This disastrous pandemic of COVID-19 has impacted our lives to a great extent. And as evident from this newspaper clippings right here, the blood transfusion services has also been under great distress. So, sir, our first question to you would be that how has this pandemic affected the blood transfusion services and the conditions of your patients?
Yeah, thank you, the Medical Students Network. I'm very happy that, medical students are trying to raise the awareness. I think before answering your questions, I'll share a small anecdote, which Dr. Fawad was mentioning about challenges. Challenges within the medical profession are still there. So around 10 years back, we used to have an internship in the Institute of Hematology at Medical College, Kolkata. So the interns used to come and we used to tell them, that whole blood, there were two things which in our state, we have specifically written even in the blood requisition form, that whole blood does not exist. Okay. So that people can't ask for it. And the second is that if you are asking for 1 unit of blood, please think again, because just as if I donate 1 unit of blood, it doesn't affect me. Transfusing 1 unit of blood also doesn't possibly help the recipient. It can be managed otherwise. So the interns, they went away, and then one intern, she was a lady, she came back to me and told me, sir, I went to another department, and when I told them, and yeah, so the basic thing what she told them another was that, for elective surgery, you can keep the blood units reserved at the blood bank. Because according to regulations, once the blood is out, it is cross-matched and released for a particular recipient, it cannot be transfused to any other. So the standard practice should be that if you are doing an elective surgery, you can reserve the blood in the blood bank. If necessary, you take it. Otherwise, since it has not been released from the blood bank, it can be used for others. That is what Dr. Fawad was talking of, 6% wastage. In fact, in certain tertiary care hospitals, on behalf of the transfusion committee, when we have done audit, we have seen the wastage can be more than 10%. And you open the refrigerator and you see the blood packets all lying there. So then what she came and told me was, so I was telling when they were asking for 2 units of blood for cholecystectomy, I told them, why don't you reserve it in the blood bank? And their seniors told them that, don't try to teach us all these things. Whatever we are telling you, do it. You go and fetch the blood and keep it in the OT. So what I wanted to share with you is the awareness has to be raised amongst the medical students, amongst the medical practitioners also, because, since it is such a valuable product, we can't afford to waste it, and we should look at rational use of blood, optimal use of blood. Now, the good question you have asked me is impact of COVID-19. Yes, COVID-19 has affected every single country in the world. It has affected every single state in this country. And has it affected the blood transfusion services? I think in several ways it has done. See, when you are dependent on voluntary blood donation, and which is absolutely the norm to ensure safety of blood transfusion, you need regular donations. So the first thing is, when you suddenly declare a lockdown and people can't come to donate, what happens to the patients? Especially, Dr. Fawad is the manufacturer and we are the consumers. So we use it all. So our patients with blood cancer, thalassemia and others, what happens to them? Because they cannot survive without blood. So let me share my practical experience which happened last year. When the lockdown was announced in late March, by April, we saw it was a very difficult situation. The only advantage was that elective surgeries were also not being held. So that blood was not going. But for emergency services, for hematology patients, there was a crisis. And we overcame the crisis by, actually, our chief minister herself helped us by telling all police personnel, whoever are fit, to donate blood. And I'm so thankful to this service, who were our frontline warriors, that they actually, if they were near the hospital, they were donating it, or they were organizing small donation camps within the police stations. So this is how we tried to overcome it. But the demand supply gap widened. And it became worse when unlock started, because the patients who couldn't come, because during the lockdown, whatever you say, you can't take a cab from, say, 500 kilometers away and come to a medical college blood bank for transfusion. So the other thing which we did was that we immediately called up the local blood banks in the vicinity of the patient and told them that, can you please arrange transfusion for this thalassemics or blood cancer patients who are at home, who are on maintenance therapy, if they need transfusion. Still, it was shortage everywhere, and the shortage skyrocketed when the hospitals opened because other departments started using the blood. Now, the problem was not only the lockdown, with unlock also, people were very much afraid. Why they were afraid? Because in India nowadays, standalone blood banks do not get licenses according to the national laws. So any blood bank has to be associated with a hospital, and the common people were afraid to come to the hospital. So your supply gets dry. Now what do? You can engage people who are within the hospital. And I'm proud to say, and you must have done the same thing, that the medical students, the nursing students, the paramedical staff all came forward to donate blood. And that is how we somehow managed it, but still the problem remained. And what happened actually was, because of such physical distancing norms, people could not even organize a blood donation camp. In our state, to commemorate different days, we actually have mega blood donation camps where there are more than 1,000 donors. Now, obviously, once the pandemic set in, we could not organize such camps. So it was maximum of 30, then it came, when unlock was more, unlock 3.0, unlock 4.0, it came to 50. But we had to organize it outside the hospital because people were still not ready to come to the blood bank. And then people were afraid, just like for vaccination, they thought if there's a crowd there, for donation, they might get infected there. So they said, no, we can't do it. And obviously, because of the infodemic and fake news all over social media, people thought they might get COVID-19 by donating blood. So there was nothing of this sort until to date. Any advisory, any guideline has shown that you cannot even, give COVID to a person by donating blood. And our primary aim is always the safety of the donor. So, but the problem was that these things actually did it. And, obviously the offices were closed, the clubs were closed who were doing it. And on top of that, there were elections in several states. And who is the prime mover of the voluntary blood donation camps? Mostly their political personnel. So one is that they cannot then do it under the political banner, the particular political party banner. They lose their interest and they get interested in rallies and other things. Every summer, per se, we have a crisis. So imagine you have COVID-19 pandemic, you have summer, and you have elections. So the sum total of this was, notorious. And obviously, because of the apprehensions, we had to go to social media and tell people, but there was a positive side. The positive side was, in my personal experience, whenever in Facebook, I wanted a particular, because, ideally it should not be replacement donors, but even our thalassemia patients were being asked that if you can't get a donor, the blood bank can't give you blood. This was only 2 months back. So when we started requesting the people to come and donate blood, then there were responses. So Facebook, WhatsApp, and even there are certain apps who have done a tremendous job. And once we told them that this is the scenario. Now, on top of that, what happened was, while medical personnel were donating blood, they were the first to receive the vaccination. So at that point of time, first interim guidance which was given by the Blood Transfusion Council was that you can't donate blood 28 days after getting a vaccine shot. So the people who were actually helping in the hospital to get the supply, they couldn't do it. And then obviously we wrote to the Blood Transfusion Council saying that that is true only for live viral vaccines. None of the vaccines available in India are live viral vaccines. And most of the countries where these vaccines are being used, they are allowing 7 days after the shot. And when you are increasing the gap between the two vaccines, when there's a gap of 84 days, even after the first dose, you can give it. And then the interim guidance came once again. They said you can donate blood 14 days after any dose. So, 14 means you have a 70-day gap. And for young people, we were telling them, before getting your vaccine, you must feel good, you go and donate 1 unit of blood. And some of them definitely responded. So now it is 14 days after a shot of the vaccine and 14 days after you become COVID negative. So obviously, when lakhs of people have been affected, I'm talking of blood donation. Now, another thing which was there, which started back in April 2020, was donation of plasma. I think that was another important story because at that time, it was approved as an off-level indication. Indian Council of Medical Research were organizing their own trial where there were several government and private hospitals. The trial was called Placid, and the first report was published in BMJ, which showed that there was no survival benefit. But we also understood that we were not measuring the antibody levels, so there might be some fallacies. So even after that study, ICMR and Ministry of Health, Government of India were allowing plasma donation. And there was an artificial need that plasma was also being sold. So you'll always get this, whenever there is a demand supply gap, people try to make money out of it. Then what happened was, in May this year, 14th May, the findings of the recovery trial was actually stopped because it showed no benefit in terms of survival. And after that, Ministry of Health has also taken off convalescent plasma as a modality to treat. Because we were aware there were certain limitations, but it could only be used in mild, moderate, and if it is used early. But now there are certain studies which are still coming, but I think it is good that if people are more made aware about prevention, rather than you get very sick, you go almost to a ventilator and then people are running helter and skelter for convalescent plasma, it doesn't make a sense. So on the whole, the transfusion service, which heavily depends on humans who had to be distant because of the pandemic, the transfusion service has suffered. The other drugs, you can increase manufacturing any molecule in the pharma companies, in the drug manufacturing units, but you cannot do this for blood. So that has been a major problem. And when there's a hero in a film, right? If you focus only on the hero and the heroines, the other diseases get neglected. So as it is, people were coming to us with a hemoglobin of 4, 3.2, 3.5, and there was a short supply. So this is a major lesson which we have understood, that COVID per se has also a lot of collateral damage. And we have to be aware of that, and we have to plan and manage accordingly so that this collateral damage does not occur.
Okay, thank you so much, sir. Sir, I want to ask a question that, as you said that we can donate the blood after 14 days of getting a vaccine jab. Is it the same for the patient who has just recovered from the infection of COVID-19?
Yeah, it's the same. Whatever they have written, there is a advisory group there called NEGVAC. So if you look at the last notification from NEGVAC, they say 14 days after recovery. Now, the problem is, people ask me that if I have not done a COVID, at one time we said that after 14 days, you can think that you are cured, you do not do a test because it is eating out some of the laboratory infrastructure, which is at a serious stress. Then also, after 14 days, there is no chance of transmitting the virus. So as it is, if you have recovered, but mind you, let me tell you a catch here. This is not to make people afraid, but people should realize that after 14 days, the virus goes away, but the effects do not go. The battle has occurred and the battleground and the wounds remain. So you might get palpitations, you might get chest pain, you might still get cough, you may face severe COVID. So all this, we are either calling it post-acute COVID or long COVID. Now, if you are not feeling well, it's not about you transmitting COVID to the recipient. It's about your well-being. If you are not feeling well, if you are having palpitations, consult your medical practitioner and do not go in for voluntary blood donation until these issues have been settled. But you can imagine the percentage of a population who are between 18 to 45 years of age. At one point of time, we used to say that if every person, the day they turn 18, they donate blood, then the shortfall which Dr. Fawad showed should not be there. But that is not the case, and the requirement and the supply is a problem. And obviously, you have to remember that it's a donation. So you don't donate because you'll get something in return. So when the supply is at peril, these replacement donors, actually, you can see that professional donors who want to earn money, they can come in the garb of replacement donors. It has happened that the family members are so desperate, they get hold of someone, they say, we will pay you, you donate your blood. And that is the greatest problem. You might be wondering, Dr. Fawad showed you that entire list. Why the questionnaire is so long? Now, let me tell you, when HIV was reported in 1980, the kits for testing the virus in the blood came much later. And there's a beautiful study which was published in New England Journal of Medicine, which showed just by asking certain questions about high-risk behavior, we could bring down the prevalence of HIV transmission by almost 1 in 1 lakh. So a good questioning is very important, and that's why, don't hide anything. And we always say that the safety of the donor is more important than the benefit to the recipient. And we should all remember it, but we should not, spread myths through this infodemic. I think you will tackle some of them, but yes, myths are myths, and you all have to tackle it in your daily lives.
Okay, thank you so much, sir. Sir, we have a question in chat box that what does the recovery from COVID means? Is it seronegative or the recovery from the clinical symptoms? That is, after how many days should the person donate blood?
Yeah. So right now, according to the national guidelines, recovery means 14 to 17 days after the onset of symptoms. Because sometimes, per se, RT-PCR comes positive around the 5th day. So it's not from the day of tasting, it's from the onset of symptoms. But if you're not sure, that when the symptoms started, it might have been some fatigue, diarrhea, loss of smell, loss of taste sensation, then it's better to take 2 weeks from the day you were tested as positive. And mind you, there are so many people and we know who have not tested themselves. But I know that they have been affected. So it is to their conscience, they will realize when they got the symptoms and when they recovered, and it should be 14 days. After that, they can go. So recovery means recovery from clinical symptoms. But as I told you, 20% of the patients might have long COVID. So that is post-acute COVID. And still, if they have a problem, because if you look at the list was last updated in October 2017. And it is there in the public domain. Any one of you can go to the NACO website or NBTC and get it. You'll realize that if you have certain cardiac problems, you cannot donate blood. Like a lot of people are on anticoagulants. So you have recovered, but you have been prescribed anticoagulants while you are at home, post-discharge or post-recovery. So please don't go and donate blood.
Okay, thank you so much, sir. I think this clarifies all of the doubts of the audience. And sir, yesterday, that is on June 19th, we celebrated Sickle Cell Anemia Day. Yeah. And would you please like to throw some light on the blood transfusion aspects in sickle cell anemia?
Yeah, so, sickle cell disease is a genetic disorder. We call it, in our parlance, we call it a hemoglobinopathy. Means there is a single mutation and then the structure of the globin changes. So the cells also, especially when they're exposed to lower oxygen concentrations, they attain a sickle shape. So that's why it is called sickle cell disease. Now, carriers, because these are all autosomal recessive disorders. So carriers, they can have sickle cell gene in them, means one gene which has been mutated, but their percentage of hemoglobin S, like in adults, most of the people who do not have a hemoglobinopathy gene, HbA is more than 90 to 95, 96%, right? So herein, they can have hemoglobin S, and that usually does not cross 25 to 30%. Now, if one of the parents has this hemoglobin S gene, that means he or she is a carrier, And remember, these are independent of sex. So the other is a beta thalassemia carrier. Then there is a 25% chance of the child being affected with a disease which is called hemoglobin S beta thalassemia. So they are there. Now, if both the parents are hemoglobin S carriers, then there is a 25% chance of the progeny being affected with what we call homozygous sickle cell disease. That is SS. That was S beta. This is SS. You can also have hemoglobin SC, which is not common in our country. It is common in Africa and certain others. So what happens is these people have a high chance of getting end organ damage, which includes the chance of stroke and other disorders. Most of them have a functional aplasia or asplenia in the spleen by the age of 1 to 2 years. So they should be put on penicillin prophylaxis, and we try to ameliorate some of the symptoms by using hydroxyurea. But there is one group, especially of SS, homozygous sickle, and S beta, who need regular transfusion. Because in S beta, the globin production is also low, and in SS, HBSS, you need exchange transfusion sometimes or transfusion so that you can lower the percentage of the HBS. Other than regular transfusion, there are a lot of studies on that. Other than regular transfusion, during pregnancy, during surgery, you need to transfuse them so that you can reduce the HBS level to less than 30% so that they do not have the complications of sickle cell. So this is what is done. In thalassemia, I should mention in the same breath, because I think that is in India, one part of the country, especially, Maharashtra, Madhya Pradesh, Chhattisgarh, Jharkhand, Orissa, you have sickle. In certain other states, including UP, but more in Punjab, Gujarat, Bengal, Assam, you have thalassemia. Now, thalassemia is also, there can be hemoglobin E beta, beta major and all that. But for clinical parlance, we say transfusion dependent thalassemia and non-transfusion dependent thalassemia. So I see you're asking me indications for starting transfusion. Now that's a very good question. The first thing I would like to tell you is that the genotype sometimes predict it, but not at all times. The first thing is, if there is severe anemia, which is giving rise to symptoms in the child, and if you get palpable hepatosplenomegaly, you should suspect it. If the hemoglobin is low, you should keep a sample in an EDTA vial so that you can do a hemoglobin electrophoresis or hemoglobin HPLC and then transfuse. Because the problem is, once you have transfused the child's blood may represent the donor's hemoglobin component, and in thalassemics, be it beta thalassemia major or E beta or even sickle beta, the hemoglobin F is high. But once you transfuse them, the hemoglobin F can go down to a low level, which may never recover. And then the only way you can diagnose is by molecular diagnostic studies. So when should you start transfusion? Obviously, if the hemoglobin is very low, or it is not that low, because we have what we call a thalassemia intermedia phenotype, where the children can present later in age. Some may present even in adulthood. But if you see that the growth and development is not okay, so nowadays, you don't have to memorize anything. You have those apps, put in the height and weight, calculate the mid-parental height also from the parents. And if you see that the growth and development is not adequate, or the spleen size is increasing because of ineffective erythropoiesis, that is the time you should start transfusion. Previously, we were afraid to transfuse much because we knew that there would be a lot of iron overload, and so that would be a problem. But now we have good oral iron chelators. So don't worry about the iron overload. First is not only for survival, for proper growth and development of the child or even in an adult, you should start transfusion. But remember, if you start transfusion late, then the chance of developing allo antibodies is more. And whenever the blood bank has a facility, you should do a complete blood group phenotype. So the phenotype should not be restricted to the ABO and the RH systems. There are more than 200 blood group systems. Now, why don't we focus on all of them? Because the rest of them do not produce so much of a problem. But when you have a multi-transfused patient, like say aplastic anemia, thalassemia, then these minor so-called blood group antigens like Kell, Duffy and others can create a lot of problems. So any tertiary care blood bank now has the facility also to do a complete blood group phenotype. So the blood group phenotype should be done, and then as much as possible, I know it is still a challenge in most of the blood banks, but in certain tertiary care blood banks, just as NAT is available only in a select few blood banks, you have the facilities of giving phenotype matched blood transfusion. And another thing is important, though we are speaking of components, that 1 unit of blood donation can save 3 lives. Those red blood cells, the packed cells, can have a lot of white cells, which can give rise to non-hemolytic transfusion reactions. So it is always better to give leukodepleted blood, right? And ideally, especially the immunosuppressed and people at extremes of age, newborn and very elderly, should also receive irradiated blood products. So, it's a bank. So this is one bank where you might keep the money there. You might keep your blood there, but somebody else gets it. And that is the same for even your financial banks. If they don't get money from you, they can't give loans to others. So in this bank, you have to donate it. And remember, we are trying to make blood transfusion as safe as possible. But if you hide certain things, because we do only certain tests, if you are not honest enough, then it becomes a problem. But at the same time, please do not excuse that I am not feeling well. So, I must have a problem. I should not donate blood. That kind of attitude should not be there.
Okay, thank you so much, sir. This has clarified a lot of concepts of mine. And I've developed a lot of interest in hematology now after listening to your views. So, as you talked about some myths, I would like to call Saima to discuss a few myths which has been around blood transfusion in our society, and please counter them, sir.
Yeah, and I'm so happy that Dr. Fawad has informed me that phenotyping for antigens is being done in the AMU blood bank. So,
yes, for certain antigens, like apart from like ABORH, we are doing KEL, and we have the capability to do, if required, we can screen the other kind of antigens as well. We are doing antibody screening for all the donors as well.
Yes. So see, this is how the blood banks become safer and we can reduce transfusions. But on the other hand, as consumers, so if you go to a hematology department, you will never see that the blood unit is there, because we only requisite a blood unit when we need it. But in certain departments, there are problems. And that's why he showed you, I think, Dr. Fawad, you said around 50% only have transfusion committees?
Yes.
In hospitals? Yes.
It depends.
So
there's a range, like in developed countries, it goes up to 63%. And in developing countries, it is down to 35% or so.
Yeah. So that is what we always try to tell: rational use of blood. Like for increasing hemoglobin, you do not need blood transfusion. If you have identified the cause, if you've identified iron deficiency, give iron. If you have identified, there was a question in the chat box initially that do vegetarians, can they donate blood because they might have? So don't worry, we are checking your hemoglobin. If your hemoglobin is low, we will not ask you to donate blood. But all vegetarians do not have anemia. So don't worry about that because you're a vegetarian, you can't donate blood.
Yeah. Only thing is you need to have hemoglobin of 12.5%. So whether vegetarian, non-vegetarian, you're strictly vegetarian, whatever, you can donate blood.
Yeah.
Usually you need to be healthy.
Yes.
That is the basic criteria.
Absolutely. Even thalassemia carriers can donate blood, because in my state, thalassemia carriers are almost 10 to 20% of the population. But they also have a hemoglobin above 12.5 and they can donate blood. It's not an issue.
So as Dr. Prantar sir had said that during COVID time, it became a huge problem for arranging blood, especially for those people who needed regular blood transfusion like thalassemics or cancer patients. Yes, in our hospital also, it was really big challenge. And ultimately we relied on our own fraternity of students, PGs and undergraduates. And also sometimes we had to ask it was not I would say that sometimes we had to tell the thalassemic attendant as well that somehow, because that was an extraordinary time, we had to tell them that please, for at least for once or twice, you need to arrange some donor. Then slowly we came up this we found the solution for the problem, but it was a really big challenge.
Okay, thank you, sir. Thank you for your expert advices on these topics. And now I would like to invite Saima to ask you about some myths.
One more thing I would like just to if you allow me, as said that evidence-based transfusion is very, very important. And more, whatever you say, it is still less. And you are the right people to to sensitize, because ultimately you are going to become doctors one day, and you are going to write transfusion and you are going to transfuse the people. So it is very important that you need to do it on evidence based. It is not like this. Like I regularly receive the requests for plasma because it gives better healing of wounds. So again, it's something which is, and you all should know that every blood transfusion carries a risk also. Not only in terms of transfusion transmitted infections, but other ways also. Like it's a foreign body, so when it goes inside, it produces a lot of things. So every blood transfusion carries a certain bit of adverse, chances of adverse reaction as well as mortality risk is there. So one should always weigh the benefit versus the harm. So it should always be based on evidence. And there, sir is right that we need to do a lot in that regard. Medical education of the clinician is very, very important, and this should be done very sensitively, because people are usually not very keen to accept your advice.
Okay, thank you so much, Fawad sir and Prantar sir, for sharing your valuable insights. Now we are heading towards our next activity. As we all know, myths have idiopathic origin, but one thing for sure, we all love them. And we share these myths as if they are facts without ever verifying them. So let's debunk some common myths regarding blood donation. So Prantar sir, here's a very common myth that you can donate blood only once a year, as frequent blood donors are more prone to infections, and donating blood very frequently weakens the immune system. Sir, please clarify this thing.
Yeah, so I'll tell you that if you give 1 unit of blood, right, your immunity cannot be harmed, because your immune system, as you have been taught, I believe, by your second, third years, that there are so many components to it. Why do we say that when you're donating in a blood bank, means a whole blood unit, which will then, the components will be processed every 3 months, is not because that it affects your immunity. It is because it can cause iron deficiency. Okay, so that is the truth. Frankly speaking, other than deferring your blood donation for 3 months in a blood donation camp, or when you donate blood, if you're donating single donor platelet, right, where there's a machine, we call it a apheresis machine or a cell separator, it takes only platelets from you. You can donate in 7 days. So that same blood donor can come back after 7 days and give it, because the normal platelet count will be recovered by 7 days. So if you think that you can give it only once a year, then my advice is that if you're so much unhappy that you will get harmed, it is better that you take good balanced diet to replenish your iron stores. You might take even iron supplements, but please go and donate every 3 months. And let me share a story again here. When I was in medical college, and the Japanese consortium are building a metro railway there, underground railway called East-West Metro. So one day I find 5 Japanese people, okay, and they were in front of my hospital building saying, "Where is the blood bank?" It's difficult sometimes to understand their English. I said, "Blood bank? Why?" He said that according to Japanese custom, wherever they are in the world, they go and donate blood every 3 months. So because those 5 people have donated blood 3 months back, sometime in, I think they belong to Osaka or something, they want to donate blood. So they have come to medical college. They're searching for the blood bank to donate blood. Now, this is the spirit of donation, okay? So obviously, this is a myth which should be busted. And people, if they still think it is true, people who are saying it, tell them to provide the evidence.
Okay, sir. Thank you so much. This was quite inspirational. Now, Fawad, sir, we have the second myth that people on hypoglycemic drugs or on antihypertensive medications, they think they can't donate blood. Are there any specific conditions associated with these diabetic and hypertensive patients in which they can't donate blood? Or this is just a myth?
See, no, basically, there is a range which has been, first, there are two things. First thing is that if the patient is hypoglycemic, that means if he's having diabetes, or if the patient is hypertensive. So in both the cases, after the treatment of oral medicines, he should be like in the normal, he should be having normal values. Like his either blood sugar or the blood pressure should be controlled. So then he can donate blood. But in case of diabetes, if he is on insulin, then he cannot donate. But even if the blood sugar is very much controlled, the basic reason behind this thing is that when you donate blood, it is affecting your hemodynamic system. So the people who are hypertensive, the body is compensating somewhere. When the person is suffering from high blood pressure. And when at the same time when you donate blood, we exactly don't know what kind of reaction the body would undergo. So it is therefore it can harm. So that's why it is important to control the blood pressure by drugs or the sugar by oral drugs, and then you can donate blood.
Okay, thank you so much, sir, for enlightening us with this.
I'll tell you, according to the guidelines, there is only one caveat, that the dosage should not have been changed in the last 4 weeks.
Yes.
Because then there is a chance that there might be these episodes. But anyone on oral hypotensive drugs or hypoglycemic drugs can donate, provided they are having a normal profile.
Okay, thank you so much, sir. Now heading towards the next myth. There's a gender bias myth. People think that women can't donate blood as they are usually anemic and they undergo menstrual cycles, so they should avoid blood donation.
So I would say it is again a myth, because as I had said earlier also, the basic requirement of a healthy donor should be fulfilled. That apart from other things, blood hemoglobin should be 12.5 gram%. As long as it is 12.5 gram%, anybody can donate blood, whether he is a male or a female. Yes, during the time of menstruation, that time one should not donate blood, because there is a loss of blood volume, and so that time, apart from that time, she can donate blood. And another thing which one should keep in mind is that when any lady is donating blood, she should keep in mind that she is not carrying, and she is not lactating, and so these all things also need to be kept in mind. If she is doing so, then she cannot donate blood. Otherwise, any female, just because she is female, she cannot donate blood, that is not correct.
Okay, thank you so much, sir. The next myth is it is quite trending to have tattoos and other body ink mark designs on the arms and hands. So the people think that if they have tattoos, they can't donate blood. Prantar sir, can you please share your views on this?
Yes. So first of all, what happens when you are getting a tattoo, right? You are using needles on your skin. And if these are not properly sterilized or if they're not disposable, then there is a chance of transmission of hepatitis B or hepatitis C or HIV, right? Now, imagine if you are going to a tattoo studio and getting it done, you would not like to get infected with it, right? So the only problem is that in certain cases, we have seen that it has been done, that there has been transmission. So if you look at the list, tattoos per se, I have not found it that it is specifically mentioned. Dr. Fawad might say because I have not gone through the entire manual. But if you have undergone it, if it is considered as a minor surgery, right? Because you're invading your tissue, then you can donate after 6 months. If you are so much aware, because it has been proven that even if you go to a saloon and if you shave with a blade which has been used by someone else who had hepatitis B or C, then it can be transmitted, right? So that is the only thing. But I think official guidelines, Dr. Fawad would be able to tell you better because I'm not aware of this.
Official guideline is like now present. Previously it was 6 months, but now it is 1 year. And basically, why 1 year? Because see, once the infection which could have gone inside the body, see our present technologies which detect the transfusion transmitted infection in the donated blood, they are still not. You cannot 100% rule out the infection inside because of the various reasons. One is that there is technological limitation. Other is that there are window periods. So because of that, we need to give ample amount of time through which our present technology of transfusion transmitted infection testing could detect it. So by taking it to the safer side, it has been decided that okay, let's take it for 1 year. If by that time our system doesn't find anything reactive in the blood, then he can donate blood. That's the reason.
Yeah.
Okay, thank you so much, Prantar sir and Fawad sir, for sharing such your expert reviews. We are so glad to have this session with you. Now I request Raghav bhai to please carry forward.
Okay, so sir, it's an open section now for the audience, and as we can see that you have answered almost all of the questions, but there is just one question remaining for Fawad sir. That sir, has there ever been any audit in Jnmc which has decreased the blood wastage?
Is there any audit? No, I don't think there was any audit has been done so far. But it is suggested that I mean, for every department there should be internal audit to improve the system, like whatever things are going wrong. So in the same way, there need to be internal audit in the blood bank also, and the data needs to be gone through, and then we can find findings. We can have findings, and that can help us to pinpoint the problem areas which can be then addressed to. Like when I was in Tata Memorial Hospital for my 1-year training, there I had done an internal audit for the basically overnight blood transfusions. I had done an internal audit because overnight blood transfusions are not considered to be safe. That should be avoided. So that way, internal audit can be done of many things, and they should be done because to improve the system.
Yes, and I think in the new UG curriculum, all undergraduates are supposed to do at least one project. And I think transfusion medicine is one area where you can do it, and you can actually help the improvement in the delivery of care services.
Yes, I think because there are many things they can do there from our side, from the blood bank side, and from the user side, like on the clinical side, like what is the basically practice now? Is it evidence based or is it not? These things can be done, and this can be very helpful because as a student you can print out many things which we will ourselves will have difficulty in doing that.
Okay, so sir, I'm getting some questions on your personal chat also that USA has recently allowed the blood transfusion services for the LGBTQ community. And uh, what about in India? Should it be started? Is there any risk about getting blood from a person from LGBT community because of some increased risks or something?
Yes, in the blood bank guidelines, there's a during history taking, it is important that you need to identify the risky behavior. So in the risky behavior category, sex with a male having sex with another male is considered to be a risky category. So yes, they cannot in India, they cannot donate blood.
Thank you so much, sir. So now I would like to uh, invite Dr. Aatika for carrying out the session further.
Okay, thank you, Dr. Saima and Dr. Raghav, for wonderful moderation of this webinar. I'm very grateful for our patrons also, Professor Ziaur Rahman sir and Dr. Bharat Kumar sir. I think he couldn't join, but Professor Ziaur Rahman sir is with us. Professor Ziaur Rahman sir, if you would like to say something, some words of advice for us, the floor is all yours.
Thank you, Aatika. It was really a wonderful session which you people organized. I would like to congratulate IMA and the Medical Student Network of Jnmc for organizing such a wonderful session on the COVID and blood donation. I was really amazed to see the conversation between you all, and especially the excellent conversation by Dr. Prantar sir, and Dr. Fawad is already throwing some lights in relation to the blood bank of our college. There's one thing which I would like to discuss, or just to tell you that there should be a greater role of hemovigilance program of India, especially in this COVID session. Already there is very few cases which are reported to the hemovigilance program of India, which is the headquarter is the Ghaziabad Indian Pharmacopoeia Commission, and we all know that coronavirus, this may affect various phenotypic characteristics of the blood, and we don't know how the coronavirus is affecting the different types of blood. So there is a chance or greater chance of having a serious reaction with the blood transfusion. So I don't know how much reporting is being done through our setup, through our college, and also. So it's just because it's a new disease, and in this pandemic, we should be more cautious in giving blood, especially in this pandemic when most of the cases they are asymptomatic, and we don't know how the coronavirus is affecting the different types of blood. So this is just my query, and I don't know about this thing, but all these people who are working on this hemovigilance program of India, they should be very well versed. And once again, thank you for all this wonderful lecture and the whole team. Thank you.
Thank you, sir. We are indeed indebted to you for your constant support and encouragement. I'm also thankful for our UP State Convenor, Dr. Lakhan Prakash Gupta, who joined us today. How was the session today? Can you give us some feedback, sir?
Hello. Yeah, I'm audible to all?
Yes, you are.
Yeah, okay. Greeting to all the respected speakers, Dr. Prantar Chakrabarti sir, Dr. Fawad Khan sir, for enlightening the whole session. And a special thanks to the patron, our patron, respected patron sir, Dr. Ziaur Rahman sir and Dr. Bharat Kumar Vashni sir, and all the participants who joined today. So also I would like to congratulate the whole MSN Aligarh unit, especially the Vibhor Gupta, Aatika and Intekhab Akram for organizing this wonderful session today. I'm personally pleased with this session. Okay. So as a lot of valuable words have been shared here by our respective speakers, so I just want to quote a very simple and very famous quote here that Raktadan Mahadan. As a medico, we should be our total aim should be learning and emerging. So here I end my words on the behalf of MSN Uttar Pradesh. I would be looking forward for such more valuable events, and the event was wonderful, and the MSN Aligarh unit have done a marvelous job today. So yeah, thank you to all.
Thank you, sir. Now I would hand over to our Aligarh unit convener, Dr. Vibhor Gupta, to end the session with few words.
Okay, thank you, Aatika. It was indeed a wonderful session. My heart is filled with lots of gratitude and respect for our distinguished guest panel, Dr. Major Fawad Khan sir and Professor Prantar Chakrabarti sir, for not only sparing their valuable time for this event, but also educating us about the importance of blood donation in this time of pandemic, when there is acute shortage of blood in blood banks. Thank you for motivating us. We all will surely try to donate blood soon. In the end, I would also like to thank my team, especially Aatika, Intekhab, Saima, Raghav, Ammar, Maryam, for creating such a wonderful idea and executing it and making the event successful. And in the end, I hope all will remain healthy and safe in these challenging times. So thank you once again and have a nice day. Jai Hind.